So Carol, good morning.
Good morning.
So we are exactly 7 days, right, from your face, surgery, lower face and neck lift is what we call it.
Yes.
And we did some, what we call UltraClear laser for the mid face, where we did not operate with. That's the patch marks that you see or the spots that you see on the forehead. So how do you feel 7 days out?
I feel really good right now. It was a process getting to this place, but definitely feel much better. Feel a little heavy still in the sides and very swollen, but I can see the before and afters, and it's amazing how much definition I have now in my neck and my jaw.
So what finally pushed you to do this? You said it was a journey. What took you long? What was the journey like?
I think I realized like time is just passing me by and I'm getting older, and why not just do it now? It was something that always bothered my mother, and I remember her talking about it, and I said to myself, you know what, I'm not going to live my life with any kind of regrets. I'm just going to do it.
And tell us a little bit about your healing process. Like, how was that tough? Was it
The first couple of days were really difficult. I did take the pain medications, and it was hard to get comfortable. I would say it was less painful and more uncomfortable than anything. And my ears felt really weird. I mean, they still do. I still feel numbness and tingling in my face, but God, it's gotten so much better. I couldn't even talk at first, and now able to talk and eat better.
So when did you think after surgery, which the surgery was last Monday?
Yes.
When did you think you kind of transition from that to maybe a bit more of a comfortable place?
I was staying at my mom's on Monday and Tuesday, and that was hard. And then I came home to my own place, and it was very comfortable. And so Wednesday, I stopped taking the heavy meds and just started using Tylenol extra strength. And besides some uncomfortableness, I actually have been able to sleep, except for, there are some times where I just can't find the right pillow combination. But it really hasn't been that bad. I have been sleeping and resting.
Good. And how do you feel about the bruising? Is it kind of going away at a slow pace, a rapid pace? How do you feel about that?
No, I think it's going away pretty quickly. I've been wearing the compression bandages. I'm very follow by the rules. And I definitely see the yellowness now. So I see that it's turning from the black and blue to getting a lot better.
So where is the area that you noticed the maximal change from the surgery? Because we did again what we call the lower face and neck, which essentially goes from the the ear area all the way down to the jawline and the bottom of the neck, all the way to the the collarbone area. Where do you find most of the change?
Most of the change right now I see in my neck. This feels very swollen to me right now, even to the touch, like it feels hard. But I can see the definition in my jawline. I can see how it's going to be. I just, I know that in time, all of that swelling is going to go down and I'll look like myself again. I look more like myself to me when I'm wearing the bandages at this point. So I don't mind wearing the bandages because it hides the, distortion right now.
Right. So if somebody else were to be interested in doing something like this, do you have any thoughts for them to consider or kind of tell them, in their own journey of like it took you a while to get to where you kind of you said you had a journey.
Yeah.
What would you tell them from the other side now?
I tried a lot of different things before I did this. I tried the Morpheus 8, and while it was good for my face, it wasn't good for my neck. I just say do it because you only live once, and if you want to look the best you can for you, which is all I want, is to look good for me, I would look in the mirror every day and just lift my chin up and pull it in the back, and I'm like, oh wow, that would be perfect. So here I am.
Perfect. Thank you so much.
Oh, thank you.